What we are able to do now that we were not able to do before is to look at a problem and find a solution for it, rather than to look at a problem and feel like it is never going to be solved.
The Leadership, Management and Governance Project has worked with people in 93 low and middle income countries, developing inspired leaders, sound management and transparent governance. In Uganda, the LMG Project partnered with the International Planned Parenthood Federation Member Association, Reproductive Health Uganda. Working in teams, Reproductive Health Uganda staff identified and overcame challenges they faced in delivering health services. Using the LMG Project's Leadership Development Program, teams learned how to diagnose and solve problems by creating shared visions, pinpointing root causes, and committing to achieving measurable results. Teams work together on real-life problems and learn skills they can apply to future challenges.
In our branch of Gulu, we used to suffer from challenges of stockouts. Right now, as we speak, Gulu is one of the most stocked facilities in the organization. And by so doing, they have registered significant increases in client load. They have registered a lot of confidence. That is just one example.
LMG Project has really helped us in very many aspects. First of all, it made us to identify, us to have visions. You know, when you have a vision, you're able to work towards to achieve this vision. And then also it helped us to identify our own problems. So when you are able to realize your problem, it helps you to see ways of how you can manage this problem. So this has really helped us so much to empower us to see how we can source for these supplies. And at the same time also, it has increased the demand for services because people know when they step in this place, we now have enough supplies, we're able to treat them effectively. Now, different clinics are able to sit down as a round table and they're able to identify their problems that they're facing in their clinic and they address it appropriately. And this has been brought by the LDP Plus. So we are very excited of that.
The LMG project has given us a sense of leadership and ownership because every member of the team, all the staff members are aware of this LMG project and they have taken up ownership. It is not only the responsibility of the in charge to ensure that the branch is operating well, we are seeing clients, but everybody at their duty station knows that they're supposed to ensure that we attain our results as an organization.
The poor performing clinics are now performing better. We went to other member associations to develop them. For example, UMATI, that is in Tanzania. We went and developed the trainers. We trained the trainers in Tanzania. The organization for the IPPF is called UMATI. And they did the same thing we did. They found it interesting. We have already gone to at the middle to see the learning session, how far they have gone. And they have beautiful plans which have been really implemented. Similarly, we went to Malawi also. Malawi is called the Family Planning Association of Malawi. It is also a member association for the International Planned Parenthood Federation. So we developed the trainers as we did in UMATI. They really embraced the program. Right now they are implementing, they did a step-down training, they are implementing, they have written their projects. We exchange mails, they are telling us that things are moving on well.
In Afghanistan, women in the Besod district were leaving the community for health services because there were no women providers at their clinic. The Community Council participated in a health governance training with the LMG project, which transformed the way the council interacted with the clinic. As part of their responsibility to improve access to services, they coordinated with another community to bring a female doctor to the clinic. 4 teams from Planned Parenthood Association of Ghana completed the LDP Plus and improved access to family planning and reproductive health services by reaching out to religious leaders to encourage family planning acceptance. Collaborating with youth groups to tailor services and messages for young people, and addressing the need for confidentiality by adding a new private entrance to the clinic. In less than 6 months, teams from 3 regions in Ghana reached an additional 15,096 youth and adults with sexual and reproductive health services and education.
With LMG, you have to act like a leader. If something is blocking you, you have to look for a bypass around it. So that knowledge was impacted to us by LMG.
And that means more programs, and that means we have been able to reach more communities with services. We are now saving more lives. We are averting more unwanted pregnancies, and therefore we are giving life to more people.